What does a surgical oncologist do? When should a cancer patient meet a cancer surgeon? When someone is diagnosed with cancer, one of the biggest questions they ask is, which doctor should I meet first? A medical oncologist, a radiation oncologist, or a cancer surgeon? Many patients are surprised to learn that meeting a surgical oncologist early can significantly influence the entire treatment plan. In this video, I'll explain exactly what a surgical oncologist does, when surgery can cure cancer, and why cancer surgery is very different from routine operations. Hello, I am Dr. Suraj Manjunath, Senior Surgical Oncologist and Robotic Cancer Surgeon at Apollo Hospitals, Bangalore. One thing I frequently notice is that patients and families are confused about the roles of different cancer specialists. Many people assume that cancer treatment is only chemotherapy or radiation. Others think that surgery is needed only to remove a lump. The reality is far more complex. Today, I want to explain what a surgical oncologist does, when you should meet one, and how cancer surgery fits into the overall treatment journey. What is a surgical oncologist? A surgical oncologist is a surgeon who specializes exclusively in the diagnosis, staging, treatment, and management of cancers. Unlike general surgeons who perform a wide range of procedures, surgical oncologists undergo additional training focused on cancer biology, tumor behavior, cancer staging, multidisciplinary treatment planning for cancer, and advanced cancer surgery techniques. Our responsibility is not simply removing a tumor. We have to understand how the cancer spreads, whether surgery is beneficial, how much tissue needs removal, whether lymph nodes need removal and how much, whether chemotherapy should come before or after surgery or at all, whether radiation is required, how to maximize cure while preserving quality of life. Cancer surgery, therefore, is both a science and an art. Surgeon versus medical oncologist versus radiation oncologist. Many patients ask, Doctor, aren't all cancer specialists doing the same thing? The answer is no. A medical oncologist specializes in systemic treatments such as chemotherapy, targeted therapy, immunotherapy, and hormonal therapy. A radiation oncologist uses highly focused radiation beams to destroy cancer cells. A surgical oncologist physically removes cancer through surgery when appropriate. Think of it this way. The surgeon removes what can be seen and safely removed. The medical oncologist treats cancer cells throughout the body, and the radiation oncologist treats specific areas using radiation. In modern cancer care, these specialists work together as a multidisciplinary team, and the best outcomes for a patient happen when treatment decisions are coordinated rather than made in isolation. When should a patient meet a surgical oncologist? Many patients believe they should meet a surgeon only after all investigations are completed. That is not always true. In fact, early consultation with a surgical oncologist can be extremely valuable. You should consider meeting a surgical oncologist if a biopsy confirms cancer, imaging, that is scans, suggests a suspicious tumor, a lump is detected in the breast, thyroid, or elsewhere. A cancer diagnosis has recently been made. Surgery is being considered as part of treatment. An early consultation helps determine whether surgery is required, when surgery should be performed, whether chemotherapy should come first, whether minimally invasive surgery is possible, whether robotic surgery may offer advantages. Good treatment planning begins early. Is surgery always required in cancer? No. This is another common misconception. Not every cancer patient needs surgery. Some blood cancers, for example, are treated primarily with medications. Certain advanced cancers may respond better to systemic therapy. Some cancers may require radiation as the primary treatment. However, for many solid tumors, surgery remains the most effective way to completely remove cancer and achieve a long-term cure. Examples include breast cancer, colon cancer, rectal cancer, thyroid cancer, kidney cancer, early lung cancer, oral cancer, many gynecological cancers, and many more. The key is selecting the right patient at the right time. When is surgery curative in cancer? Patients often ask, can surgery completely cure cancer? The answer is yes, when the cancer is detected at a stage when it can be completely removed. Surgery can be curative when the cancer is localized, there is no widespread metastatic disease, adequate margins can be achieved, and the necessary lymph nodes can be removed. In many early stage cancers, surgery alone may be sufficient. In other situations, surgery may be combined with chemotherapy or radiation to improve cure rates. The goal is not simply removing a tumor. The goal is removing every detectable cancer cell while preserving function and quality of life. Why is cancer surgery different from general surgery? Many people think a surgery is a surgery. Actually, cancer surgery follows very different principles. For example, removing a gallbladder or an appendix is very different from removing a cancer. Cancer surgery requires precise staging, understanding tumor biology, planning safe surgical margins, lymph node assessment, reconstruction when necessary, long-term surveillance planning. The operation itself is only one part of the treatment journey. Every decision before surgery and after surgery affects outcomes. Why cancer surgery planning is different from general surgery? In cancer surgery, the goal is not just removing a mass. We must remove the cancer along with adequate margins, assess lymph nodes, preserve vital structures whenever possible, and ensure the surgery fits into the patient's overall treatment plan. Sometimes chemotherapy is given before surgery. Sometimes radiation is required before or after surgery. Sometimes robotic surgery allows us to perform highly precise procedures through smaller incisions. Cancer surgery requires careful planning because every decision can affect cure rates, recurrence risk, and long-term quality of life. That is why specialized cancer surgery matters. Modern advances in cancer surgery. Cancer surgery has evolved tremendously over the last 2 decades. Today, we can offer robotic surgery, laparoscopic surgery, thoracoscopic surgery, organ-preserving surgery, enhanced recovery pathways, precision imaging guided surgery. These advances often mean smaller incisions, reduced pain, a faster recovery, shorter hospital stay, earlier return to normal life. However, technology is only a tool. The most important factor remains choosing the right treatment strategy for each patient. Final message. If you or a loved one has been diagnosed with cancer, remember that cancer treatment is rarely a one-doctor journey. It involves a team. A surgical oncologist plays a critical role in determining whether surgery is needed, when it should be performed, and how it fits into the overall treatment plan. The earlier the right team is involved, the better the opportunity to create a personalized treatment strategy. Thank you for watching.